A warm welcome to your Barbados Today Evening News Update for Monday, October 11th. Prime Minister Mia Mottley today set out government's plan to create safe zones as she insisted that mandating COVID-19 vaccines will not work for Barbados. She made the announcement at a press conference at Lara Court this evening against the backdrop of growing calls from key groups in the country for her administration to mandate that particular workers take the vaccine before year-end.
Those guidance notes, which the Ministry of Health will issue very shortly, will make one fundamental point for us straight off. That they will be testing persons based on risk. And what do they consider as high-risk areas? Intensive care units, be it the medical intensive care unit, the surgical intensive care unit, accident and emergency, urgent care facilities, the 24-hour urgent care that we have in the polyclinic, the isolation facilities where the doctors and nurses and other staff, they are at risk because the person in isolation is already positive. Swabbing centers, nursing homes and outpatient clinics. The Ministry of Health has indicated that those are the high-risk areas, and therefore when you see the guidance note come out later this week, it is anticipated that unvaccinated persons, for example, in these high-risk areas will have to be tested at least once a week in order to ensure that we are taking care of those who we have to take care of. The truth is that persons who are vaccinated will have a less frequent regime.
The Prime Minister is confident that safe zones will work, and she believes it's in the country's best interests.
We're taking decisions that hold this country united, and that there are some who believe that their reality is the only reality. We have said no, we're going to have a safe zone. Safe zone means vaccinated or tested. Pick a choice. Okay? And that's why we want to discuss more with the churches, we want to discuss more with the entertainment community, we want to discuss more with the workplaces. With respect to the healthcare institutions, those discussions have already started. Before I came on air this evening, I would have advised BAMP, I would have advised the Barbados Nurses Association, BW and UPW that this is what I was going to announce. Recognizing that in many instances, people would want us to be able to say, right, that or nothing. But this is not a that or nothing country.
Barbados recorded 240 new positive coronavirus cases from 1,706 tests conducted by the Best Santos lab on Sunday. Of the 94 males and 120 females who tested positive, 55 were under the age of 18, and this is a major worry for Health Minister Lieutenant Colonel Jeffrey Bostic.
This has been one of the game-changing events or occurrences in this current surge caused by Delta, so that between the 1st of September and the 10th of October, we would have had a total of 872 positive cases of persons 18 years and under. I also would report to you that currently in our isolation facilities, as at 7 o'clock this morning, we've had about 113 persons under 18 in isolation. And this is a game changer, as I said, because this is not something that we were seeing previous to this surge. And what I would like to continue to urge all parents and guardians and wards, family, that we have a duty and a responsibility to try to protect our children, especially at this time.
The Health Minister also expressed concern about the increasing number of sick patients across the board based on statistics from the Queen Elizabeth Hospital and the Accident and Emergency Department. According to Bostic, 74% of persons in isolation facilities are now in secondary isolation at the main Harrison Point Coronavirus Hospital. This, he says, has forced authorities to make critical changes at the facility.
So that where the average occupancy level at the isolation facilities across the board would be about 56% at this point in time, we are seeing about 74% in primary and secondary isolation at Harrison Point. And so in anticipation of what this could lead to going down the road, we've taken the decision, and the work is in progress, to refit the tertiary installation facility at Harrison Point so that that facility can become more of a secondary facility with the installation of oxygen and so on. And this is in keeping with what we are seeing on the ground, and we are fighting an enemy that is evolving, that is changing, that is doing things differently. And so we have to readjust our strategies and our tactics to be able to remain in this fight.
In other news this Monday, mothers will no longer have to line up outside a law court for child support payments. Word of this from Chief Justice Sir Patterson Cheltenham at today's virtual opening of the legal year 2021 to 2022 of the Barbados Supreme Court. He says a new court pay program, which is part of a court case management system, introduced in the Magistrates Court back in June by International Narcotics and Legal through the National Center for State Courts in partnership with the Barbados Judiciary, will soon be fully in place. According to the Chief Justice, it will allow mothers to go to their ATMs after receiving a text message or to use a prepaid card to collect their payments. It will also be a direct benefit to court officers in monitoring and enforcing the payment of fines.
There's regional and international news after this short break.
Hi, my name is Michelle Thompson. I'm a visually impaired person. I am also a member of the National United Society of the Blind of Barbados. I am vaccinated. I took the vaccination due to the fact that I am diabetic, I'm asthmatic, and I also have high blood pressure. I had no side effects. Everything went calm and smooth, as my doctor said it would go. Please, people, go ahead and do the right thing.
Let's roll up our sleeves and get back to living.
To regional news in Jamaica, amid a recent spike in violent incidents involving persons suffering from mental illness, there's an urgent plea for government to increase the number of mental health professionals. Shamela Pullin of Television Jamaica tells us more.
Calls for improvement in mental health services follow the recent incident in St. Catherine, where a mentally ill man attacked and killed a police officer. There was also another incident in St. Anne over the weekend in which a well-known laborer met a tragic end when he was beheaded by a mentally ill man in the town. While progress has been made to address issues relating to mental health, the demand for officials in mental health care continues.
What we need to do is to shift resources to community care. You maintain some functions, the Bellevue Hospital, but for those long-stay people who are stable and really homeless who need and less intensive community care, these people, we need to develop more of these services at the community level.
Head of Mental Health Policy at the University of the West Indies, Professor Wendell Abel believes the resources needed to address the mental health crisis in Jamaica were severely challenged last year due to the impact of COVID-19.
Further afield in Australia, Sydney's cafes, gyms and restaurants welcome back fully vaccinated customers on Monday after nearly 4 months of lockdown, as Australia aims to begin living with the coronavirus and gradually reopen with high rates of inoculation.
As part of the rest of the world have been slowly getting back to normal, residents of Australia's largest city have been living under lockdown for almost 4 months. But with over 70% of over 16s fully vaccinated, New South Wales is starting to reopen.
The first thing I'm going to do is see my parents. Actually, not see my parents. I'm going to go to Lakemba, get a Lebanese mixed plate, and then go see my parents after that.
My family's all in South Australia, so just looking forward to the South Australian border opening up, hopefully before Christmas, and getting back to Adelaide and South Australia for Christmas is our next kind of hope, I suppose.
Australia escaped the worst of the lockdowns in 2020 through a combination of border closures, partial lockdowns and aggressive contact tracing. But the rise of the more infectious Delta variant forced the country to shut up shop in June. With infections now falling, New South Wales took the decision to reopen, but other states are yet to follow suit. Some bars opened their doors 1 minute after midnight, and many hair salons have been booked out weeks in advance. Despite the celebratory mood, there are lingering concerns about what reopening will bring.
Cautious reopening is really the key to this, so we've got to make sure that we still protect ourselves, but get back to normal. Back to normal is important for mental health, but also for life, for the economy.
The spike in infections is almost inevitable. The Australian Medical Association has said it supports gradual reopening of the economy and the loosening of restrictions, but it is critical to observe the impact of each step on transmission and case numbers to avoid hospitals becoming overwhelmed.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.